Yes, everyone. My name is Arnold Payne. I'll be presenting Unit 4 time series for Data 925, Section 904 of Spring Term 2025. For the sake of the project, I chose to use a tuberculosis or TB burden by country CSV file. This file was derived from the World Health Organization, reported figures and estimates of tuberculosis burden for the Global Tuberculosis Report. This report has been published since 1997. Excuse me. Based on 2024 data, I decided that I wanted to cover three regions: the Africa region, which is the highest burdened area with significant contributions from Nigeria and South Africa. Also, I'll be covering Southeast Asia, which is a close second, has contributions from India and Indonesia reporting high case numbers. And finally, the Americas. Americas pretty much encompass North America, South America, Central America, Brazil, Mexico being the highest contributors. Also, and the Caribbean is included in that as well. For example, of the three regions, the Americas regions, has the lowest TB incidence. A lot of reasons, some of the factors that I'm not discussing that I'll just cover real quickly have to do with effective public health policies, access to health care, socioeconomic factors such as higher living standards and health education, antibiotic availability, public awareness and education, also surveillance and monitoring, that being effective systems for tracking and responding to cases being put in place. Regarding the total populations by region, that's my first graph. As you can see, Southeast Asia has the highest, pretty much coming in about 1.9 billion, followed by the Americas, which basically includes North America and South America, around 1 billion. Finally, there's Africa, which is probably in the 1 billion range as well. And that's significant because when we talk about prevalence per 100, you'll see that although Africa has the lowest population of the three, it has the highest incidence. It's not a good thing. So in this case, per 100,000, the Africas, for example, have been declining. I mean, that's a good thing, but they're still significantly higher than the other two. They're coming in somewhere around 18% in terms of caseload, where they're reporting 400,000 cases, and this isn't on here, per 100,000. 400 cases per 100,000, significantly lower than the America, which is coming in at 10 cases per 100,000, and also Southeast Asia, which is coming in at 200 cases. This number gets affected based on population. See, high, low. So, okay, and we'll move forward and we'll talk more about HIV, which significantly we're finding that these two can coexist and they come together, and there's some estimated incidence of tuberculosis cases with people who are HIV positive. Africa pretty much has had a steady increase, as you can see here, of about 30% of the cases are co-infected with HIV. Somewhere around 2004, 2005, they've made significant strides and have started to plateau downward, which is good. Americas pretty much steady across the board. Co-infection in the Americas significantly lower, as 30% as compared to 8%. That's for a lot of reasons, less of a health challenge, more public health awareness. However, when you look at Southeast Asia, they've been showing an increase. And again, around 2004, 2005, they started to plateau as well. A lot more people there in Asia, but they still are at a 20%. So you got 20% incidence, you got 8%, and you also have around 30%. To me, that's significant. So in Africa, you get HIV and tuberculosis. Now, if you look at the other graph I have, tuberculosis without HIV, you see that of the cases that they found in Asia, they're significantly higher than in Africa. So in Asia, if you have tuberculosis, you're less likely to have HIV than in Africa. In Africa, if you have tuberculosis, you're more likely to have HIV, which is very interesting for a lot of reasons. plateau, significance there. Regarding the confidence and factors, I believe here that we are less inclined to feel as confident about these numbers in Southeast Asia because of the variance between the trend lines. And also here in Africa, it's a little smaller, so that will be the second. First confidence, this is less confidence than this one. So moving along to case detection. In America's case detection is very significant. Higher detection rate, meaning that people tend to walk into the doctor's office and find out as opposed to people getting sick and spreading. In America's, we have higher social economics, better access to health care, less people, more programs put in place, better access to pharmaceutical drugs. So typically, as we're higher here and we're trending up and we're doing great, when you look at these HIV, we're low. When you look at the non-HIV, we're low. We also have a lower population, which helps out in that number. Africa, as you can see, is getting better, but they're kind of along the same line as us and have, believe it or not, the same confidence rating. So that's a good thing, particularly around 2004 that we talked about before, because that's when they started seeing a decline in a lot of their cases. They do have a lower detection rate than the Americas. Theirs is at 60%. And this is influenced by healthcare access and stigma. Southeast Asia has the lowest, unfortunately, around 70%. To try to improve in India and Middle East. So that's a big problem there. That's my presentation. I could have gone to produce different types of graphs. I really enjoyed looking at this trending data. I hope this is satisfactory and you guys enjoyed it. If you have any questions, please feel free to comment. I do have a bit of a infectious disease background, so this was kind of exciting to me, and that's kind of why I chose this. I'm really enjoying the class and trying to learn as much Tableau as possible. I also have included my citations from the World Health Organization and the Center for Disease Control. Thank you.